Well, welcome to this TMA video podcast, and we're so thankful that Dr. Mike Burgess is with us today. He's a congressman here from Texas and one of our own. Mike, we appreciate you joining us today.
Dr. McCoy, it's my pleasure.
Great. We're going to talk about the IPAB, or the Independent Medicare Advisory Panel or Payment Board. Can you explain a little bit about that?
Well, the concept behind the Independent Payment Advisory Board is that they will study Medicare expenditures, not dealing with benefits, not dealing with who gets to see whom, but simply come back and say Medicare is going to have to reduce expenditures by this amount. That recommendation goes to Congress. Congress can vote it up or down. If Congress takes no action, the Secretary of Health and Human Services is free to enact those cuts on his or her own behalf. Think of this like the Base Realignment and Closure Commission that has been responsible for doing away with some of the excess military bases in the country. The problem is that Congress is abdicating its authority. Congress should be making these decisions. If there is a budget that needs to be set, Congress should be setting the budget. Congress should be required to live within the budget, not offload that, outsource that to some unelected, unaccountable body that is just simply going to come in with the green eye shades on and says, here's the dollar amount you need to cut. You can just imagine if that board is not able to give recommendations as far as eligibility or status, what are they actually doing? Well, they're rationing care by cutting provider reimbursement rates, and we all know where that has led in the past with the sustainable growth rate formula. It's to the current crisis that we're in now. And then here's a real problem. The Independent Payment Advisory Board language does not do away with the sustainable growth rate language. So doctors, different from hospitals, drug companies, HMOs, doctors may get the double whammy, the cuts from the SGR, cuts from the Independent Payment Advisory Board, and that's just untenable.
You brought up a lot of issues there. Let's talk a little bit about this whole concept of what the powers of this board are. So they only can cut physician payments. They can't discuss eligibility, or what about hospitals and the whole mix of healthcare?
Well, they cut total expenditures, but since they're not talking about eligibility, really they're just talking about provider reimbursement. And yes, that is hospitals as well as doctors. If you really were looking for a place to say the glass is truly half full rather than half empty, this could be talked about as SGR applied across the board, so that doctors, hospitals, HMOs would all share in the pain, if you will. But remember that there's been nothing that's done to remove the SGR, the sustainable growth rate, from that particular universe, so doctors are still doubly in jeopardy with this board. What the board does is allowed the healthcare bill to pass under a budgetary number that the House leaders and Senate leaders had agreed that they would not exceed. So they were able to move the pieces around on the chessboard a little bit and use this Independent Payment Advisory Board to say, we are going to cut Medicare expenditures by this amount in 2015, 2016, 2017, and thereby get the number that they were trying to get to for the 10-year budget projection. Peter Orszag, who was, until just very recently, with the Office of Management and Budget down at the White House, had actually asked if some of those Independent Payment Advisory Board cuts could be accelerated to bring more savings, if you will, into the Medicare formula. What that savings means, of course, is reduced payments to doctors and hospitals.
Well, Dr. Sue Bailey, our TMA president, led a delegation to Washington before the passage of the bill, and we met with 17 members of Congress, all Democrats. And I will tell you that most of those House members said they didn't support it. So why did the Democrats do it? What happened that forced the Democrats to vote for this issue that was in that Senate bill?
Well, it was just that. It was the Senate bill. And shortly after the first of the year, when Senator Kennedy's Senate seat was won by a Republican and the Democrats no longer held a 60-vote majority in the Senate, they felt that their only hope of getting the bill passed this year was for the House to pick up and pass the Senate bill. At first pass on that, no House member wanted to vote for the Senate bill. It was that bad that House Democrats said no way. Some it didn't go far enough, some it went too far, but there was diffuse unhappiness with the Senate bill on the House side when that trajectory was first discussed in January. But as time went by, and it seemed like the only way that the Senate and House Democratic leaders were going to get the president's healthcare bill passed for the president was to pick up and pass the Senate bill, more of them were able to see where perhaps they could vote for this bill, even though it contained the Independent Payment Advisory Board. There's a lot of things in this bill that really no one can like. I know all week we've been talking about the 1099s, and this affects doctors too. When I go talk to my county medical societies, yeah, we're talking about healthcare policy, but we're also talking about the tax policy in this bill. Every doctor who's a small business person understands that every $600 business-to-business transaction that occurs in their office that now generates a new IRS form is going to generate significant paperwork for them. There's a lot of parts of this bill that Democrats would like to see go away. The Independent Payment Advisory Board, certainly, the 1099s, another problem, and there are other issues in the bill that I'm sure individual Democrats would like to see gone. I guess in its totality, though, was it better to pass a bill with all of these faults and still have the passage, still have the signing ceremony? And I guess that's, in the end, that's what they bought into. For my money, though, there were so many flaws in the bill. The signing ceremony was little consolation for all of the bad policy that's contained in this bill.
So we got this SGR fix, right, till the end of the year. And we got this stabilization. The 21% cut didn't happen. But what happens at the end of the year?
Well, it's not even the end of the year. It's November 30th is when the current stay expires. Obviously, there's an election that occurs between now and November 30th, and that is likely to muddle things a little bit. When that election occurs, we will come back, after that election, we'll come back to Congress, and there will have to be at least another temporary extension passed to carry us into next year. I would like to tell you that when we get back in September and get to work in Congress, that there's going to be a strong bipartisan commitment to working out the problems with the sustainable growth rate formula, and we'll have a bill ready to go and in fact pass it before Election Day, so we won't have that problem when we come back. But it's not going to happen. The problem will be there. We will come back. We will have to do some type of temporary extension to prevent the 21, or now I think it's up to 23% cuts that would occur on November 30th. And yeah, December 31st, January 1st, it's about a 30% cut that doctors are facing. So if no action occurs after Election Day, first a significant reduction down to 23 or down by 23 or 21%, December 31st down 30%, and this is obviously a trajectory that's unsustainable for doctors keeping their doors open, doctors keeping their practices open. What I expect to see is some type of temporary patch, and then regardless of who wins, regardless of who holds the gavels the first of the year in the new Congress, there has to be a strong commitment to fixing the sustainable growth rate problem. Yeah, we've got to do something with the Independent Payment Advisory Board down the road, but the SGR really has to be tackled first, and it has to be tackled first precisely because there is an Independent Payment Advisory Board right around the corner. Doctors cannot afford to face the cuts provided by both. There is nothing in the Independent Payment Board Advisory Board language that says you've got to accept the SGR cuts as the doctor's portion of the Independent Payment Advisory Board's cut. There's nothing in the language that says that. So it is entirely possible to get an SGR cut, an IPAB cut, and end up with both. That's what puts the pressure on. When I talk to leaders on my side, I say you've got to make this a priority. Everyone has to understand that it's a priority. It has to be leadership driven. We got 10 doctors on the Republican side in the House. We're likely to have several more after this election. Doctors are great on this issue. They want to fix it, but we're doctors. You know, I have my ideas, you have your ideas, but we're not likely to agree on that. Leadership has to step in and take the lead role on this and take the best ideas from several members of Congress. We have to come to some broad agreement. Is it going to be fee-based? I think it should be. It should be based on the Medicare Economic Index or some other fee-based system. We all understand what that is. That's not difficult to explain to people, but there are others who say, well, we need an entirely different method of payment and it ought to be based on a pay for performance or a PQRI standard. Okay, well, let's have that debate and decide what we can all agree on, whether it be fee-based or PQRI, and then we'll begin to build from there. You'll hear people on my side saying that this cost must be offset. I won't say that. I will say the money's already been spent. We just simply need to wipe the slate clean and start again. But there are many members on my side who would say we'll have to identify offsets. Okay, if that's the case, We all know that offsets are out there. They're not easy. They're going to involve some political pain, but let's get them out there on the table, get them identified, and begin to talk about them, because we will have to, we're past the point where we can just simply think about this. We have to, there has to be action. And whoever's in charge next Congress, one of the things that defines whether or not they're successful will be precisely this issue.
Well, I've done a couple of town hall meetings, maybe a handful, since the bill passed, and you've probably done 100 or so town hall meetings.
Not that many, but
a lot of
several.
town hall meetings. So I get questions from patients and I get questions from doctors. And the patient question I get is this the death of Medicare? Do I have to worry about my Medicare? And the question I get from doctors is, do I need to drop out of Medicare? This board scares me in my practice. What would you tell those groups?
Well, you and I know that the doctors were concerned before the board came along, and the board just puts additional pressure and additional impetus that I'm going to have to figure out something with my practice pretty quick here. So it does put an extra onus on the doctors. From the patient standpoint, we all have been talking for some time on both sides of the political spectrum about the unfunded obligation of Medicare as it goes into the future. And at some point, 2017, 2019, there's going to be big trouble in the Medicare system, and will it survive? This may have hastened that day, but let's look at that as an opportunity. If there's a chance to really reform the system, perhaps then it will be possible to not let it collapse of its own weight. So there's some intriguing things out there. Paul Ryan, a representative from Wisconsin, has what he calls the roadmap. If people want to Google Paul Ryan roadmap and see his ideas on that, it's not the last word, but it's an interesting way of looking at how he combines fixing the tax code with fixing problems in Medicare at the same time and making it a more patient-centric type of activity. Again, there are people who are going to that's going to give some people pause, but it's worth considering. It's worth talking about. If we don't talk about these things, if we just let the future develop as it appears to be developing, the death of Medicare is something that could occur, whether it be from the unfunded liability because we haven't done anything we needed to up until this point, or because of the way things have been accelerated with the passage of the health care bill.
Well, I can tell you as a doctor, I'm glad you're there. You're taking care of us, and I appreciate you meeting with us today and talking about this issue. And I appreciate you joining us for this podcast. And this video podcast is one of our first with TMA, and I hope you can join us again in the future. We'll have more of these and try to share more information about what's going on in public affairs that impacts your practice.